Good morning, February 1st, 2024. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We're here broadcasting surgery live today. We have a very, very special day. We're doing 3 surgeries on 3 different parts of the spine. The first is the neck or cervical spine. Second will be thoracic. We're doing a thoracic disc. And third will be lumbar for lower back pain. And we're starting with the neck. This patient comes to us from Pennsylvania. She has a herniated disc at C5-C6, and it's off to the left side, causing neck pain and down her left arm, but really bad headaches. So she has what we call cervicogenic headaches. You could use a smaller, by the way. That said, we're going to get started. She did not want a fusion. She didn't want artificial disc. She didn't want metal in her neck. Who does? Metal is in the past. It's passé. We're moving beyond metal. At Deuk Spine, we're doing the future of spine surgery today. And the future of spine surgery is endoscopic spine surgery. We're about to do that. If you have questions, type them up. Henry will bring them to me. In the meantime, we're going to get started. To start, the patient is facing up. She's asleep. Tube is in her mouth. Completely chemically paralyzed. Out of it. General anesthesia. This way I can feel the spine with my fingers from the front. Thank you. I'm going to place the needle, but I'm not going in yet. Shot. I got to make sure I'm lining up over 5-6. I'm too low. I'm going to come up a little bit higher, which is nice. And once again, I'm pushing down on the spine. Shot. That's 2, 3, 4, 5, 6, 7. Wow, we could have done 7-1 on her if we needed to. All right, here we are. Moving up a little bit more. Shot. All right, now we're over 5-6. It's perfect. Now let's do an AP and see where the needle is. We want to be, on the AP view, we want to be in the center of the spine. You'll know that by looking at the spinous process. We're in the center. Perfect. Let's go back to a lateral. Jordan, while I'm doing this, show them the spinous process on that AP view. See the spinous process? That's right where the needle is. Shot. All right. 5-6, 2, 3, 4. You agree, everybody? Yes, Luis? Shot. I'm going in. Shot. All right. I'm right up against the front of the disc at this point. Shot. We're going in to the disc. I just passed into the disc. So people ask me, don't you damage the front of the disc when you're doing the surgery? We don't. We're literally spreading the fibers apart of the annulus. It's fibrous. Shot. It'd be no different than putting a pin in your clothes. Shot. All right. Perfect. Henry, you see this? Jordan's going to show you the tear. There's a big tear, and you can see the herniation. The dye is outlining the herniation behind the tear. Show us the herniation. Yep, there it is. Perfect. Now we're going to place our guide wire. The guide wire will be the guide that we use to, look at that tear. That's beautiful. Show us the tear again, Jordan. Jordan will outline the tear. And that's what we're here to repair. There's disc material stuck in that tear, and the disc cannot heal. And it's trying to heal, causing inflammation. The inflammation the patient's experiencing is causing her neck pain and her headaches. And it's incredible. When you do the surgery, you get rid of about 92% of the headache, or 95% of the headaches. All right, I've injected local. We're going to make an incision. Again, we are at 2. Show us C2, just to be thorough. Go up north. No, move the fluoro north just to be 100%. And shot. Okay, there's C2. We got a little clip on the ear in front of it, or EKG clip. 3, 4, 5, 6. So we're doing C5-6. That is correct. You can see the esophageal temperature probe on that lateral view. You see that, Henry?
Yes, we do.
That's the endotracheal tube. Then there's the esophageal temperature probe.
We see.
All right. At this point, we're ready to make our 4mm incision. The entire surgery will be done with a 4mm incision. Henry, let's show the audience, why do these herniated discs cause so much pain? It's all due to inflammation. But take a look at this video. All right, welcome back. You've now seen exactly how inflammation causes so much pain, because the inflammation is trying to clear out the herniation. It sees it as a foreign body. And like any foreign body, a piece of wood stuck in your finger or bacteria, your body is going to attack it. AP? And it attacks it using one of the oldest defense systems in the body, called the inflammatory system. The newest system is called the immune system. The inflammatory and the immune system are your, and show us on the AP view, Jordan, the tears on both sides. You guys see she has annular tears on both sides. We're going to show those to you. The dye is outlining it. There it is, right there. You got that, Henry? Can you see it?
Yes, we do.
So the dye is leaking out through tears at the back of the disc on both sides. Now the dye should stay in the middle of the disc, but it's leaking out because there's tears. You can see the tip of the dilator is at the front of the disc. We're now going to advance the dilator through. As I was saying, you have two defense systems in your body that are humorally mediated. Humorally means through your blood. And the first one is the inflammatory system, been around for eons. The second is the immune system, far more recent addition to your military. And the immune system, you know, I hate to say this because I don't want people to take it the wrong way, but the immune system's probably been around for, I don't know, maybe 500,000 years.
Well, it exists in other animals too.
Yeah. Point is, the immune system is far more advanced and more specific at attacking things. But the inflammatory system's kind of like your first defense. And it's there quickly, and the immune system takes time to ramp up. But the inflammatory system's ready to go. So when you get a tear in the back of your disc, you get a herniation of the nucleus out of the tear, your inflammatory system's right there waiting, and it sees that and says, oh my gosh, we got a foreign invader, someone trying to get in here. It doesn't recognize the disc material as part of your body, a part of yourself. So it starts attacking it. And it attacks it with inflammation, which you just saw, right? All right, so let's show people how we deal with this inflammation by getting to the source, which is the herniation and annular tear posteriorly. By the way, take a look at this, Henry. Folks, the entire surgery is done through a 4mm incision. Once again, she's from Pennsylvania. She came here because she did not want traditional spine surgery, which is metal implants. Makes the implant companies rich, surgeons get rich, hospitals get rich, patients suffer with all the complications. The complication rate, by the way, of a fusion is 50%. The complication rate for this procedure is 0. We've never had a complication. What's going on? For the lumbar? Yeah. All right, questions. And then play the video.
Copy that. First question comes from Nix on YouTube. And Nix asked, how long does it take for a hernia to cause permanent damage?
A herniation can cause permanent damage immediately if it's a giant one, crushing the nerves or spinal cord, or it can take a long time, could be years. So it just depends. Great question. All right, look here. Can you see this, Henry?
Yes, we can.
Folks, these are millimeters. You can see that this incision is basically 4mm. That's it. This patient will not even be able to find her incision 6 months from now. You won't see it. This surgery is the least invasive surgery you can do for a herniated disc that actually works. Of course, you can do lots of things that don't work, which unfortunately surgeons do, but not here at Deuk Spine. We do only surgeries that work to eliminate the patient's symptoms and problem. All right, we'll take some more questions.
Next one comes from Big John on YouTube.
Big John, good morning.
And they asked, just wondering with the cervical DLDR, patients get a neck collar. Your recommendations are to wear the collar for 6 weeks. Is there any reason why it is 6 weeks and why not 8 or 12 or 4 weeks?
Great question, Big John. I don't have a great answer for you. It's just sort of, I hate to say it, tradition. tradition. It turns out that most of the healing in the spine is typically done in about 6 weeks when it comes to soft tissues. But when it comes to things like fusion, it takes longer. And the disc itself takes longer to heal. It takes about a year for the annulus to heal. So it's just sort of, I don't know. I mean, it really, to be honest with you, the highest chance of reherniation is typically in the first 6 weeks. So we kind of give the collar at Deuk Spine and tell people to wear it for the first 6 weeks because that's when the highest risk of reherniation is. So having that extra protection is good. Great question, but there's no real scientific answer. We haven't done like 5 weeks versus 4 weeks versus 3 weeks. Nobody's really looked at that, but probably something we'll eventually have to do. Great question. All right, we are at the back of the disc. You see this blue thing? Can I turn the intensity down just one notch? I think we're a little bit overexposed. Okay, so we're literally looking at the tear. You guys see the tear right there?
Yes, we do.
That is the annular tear. Annulus on the left, white annulus on the right, torn annulus with a blue herniation in the middle. This tear is trying to heal, but it cannot, and she's feeling it. Patients with a herniated disc, it's because they have a tear and a herniation, and they feel that pain because your body is constantly trying to heal, and it cannot get rid of this blue stuff. So the laser is helping the patient heal their disc naturally, as opposed to taking the disc out and putting a piece of metal in here, which is what fusion is, or artificial disc is. Now, what surgery works better, fusion, artificial disc, or Deuk laser disc repair? In terms of getting rid of symptoms, the Deuk laser disc repair has the highest success rate, higher than fusion, higher than artificial disc. Which surgery is the least invasive? Deuk laser disc repair, once again, least invasive. It's only a 4mm incision versus a 4-inch incision. And the Deuk laser disc repair doesn't cause any damage below. There's a herniation that just came out of the foramen on the left side. The Deuk laser disc repair doesn't cause any damage under your skin. It literally spreads the tissues apart because it's such a small tube, it doesn't cut tissues apart like the fusion does. If you're doing a fusion or you're doing an artificial disc, you got to cut the tissues. There's a lot of bleeding from it, a lot of scar tissue is formed, but with the Deuk laser disc repair, we don't have any of that. All right, you can actually see that this tear is a big tear, completely blown out. What other questions do we have, Henry?
This next question comes from Big John once more on YouTube, asking, with the cervical DLDR, patients, when they return home, do you have any recommendations for positions while sleeping, only on the back, flat, or slightly elevated, or what about sleeping on their side?
Hey, Big John, thanks for asking. The answer is I'm not really that good at giving recommendations on things like sleeping, how you should sleep. That's a great question. It's an important one. The truth is, as long as you're wearing that collar, then you can sleep pretty much any way that you're comfortable sleeping. I honestly don't know what's most comfortable because I've never had the surgery. And I've never really had to wear a collar. So I don't have a good answer for you, except that I don't know. All I know, 5 minutes, is that you can sleep any way you want after your surgery as long as you're wearing the collar. All right, this is the foramen here. And I have gotten out pretty much all the herniation on the patient's left side. There's still herniation here. Look at the size of that thing. That is a huge herniation. By the way, this patient's disc is different than, everybody's disc herniation is a little different. And what I mean by that, this is a soft herniation. Look how big that soft, fluffy herniation. Look how it's attached right here. It's literally scarred down. I have to release it. So that thing is huge. I can't get that out of the tube as one big piece. I'm going to have to break it up into little pieces because this tube has an internal diameter of 2.8 millimeters. So I need the laser to help me break these things up into smaller pieces. But that's a herniation right there. And there's a big one down at the bottom, which I haven't even really just started detaching it, right? These are all pieces of herniation. Now, the surgery takes about an hour total time, and recovery is about 2 hours. And the patients typically will be discharged home in 2 hours. So she's going home today. She doesn't have much in the way of bone spurs, you can see. It's pretty much just the herniation. And there's the foramen. There's just a little bit left there. I'm going to try to clean that up. And then I got to get back to this big herniation right there. I'm going to try to grab it out. I mean, there's no harm in trying to grab it out. I just may not be able to do it. But nope, I got a piece of it, but not all of it. It's probably just too big. So let me go back and work at it a little more. Keep the questions coming. I'm happy to answer them for you.
No current questions, but we do have comment from Canes25 just sending us prayers to us and to this patient.
Hey there, Canes25. Great to hear from you.
Yeah, and then just also saying God bless to Big John as well, and just sending love to everybody today.
Hey, thank you. We need it. Yeah. Yeah, I've just encountered more herniations, so let me see how easy it is to get this stuff up. So I'm having a conversation with Dr. Berndes, the anesthesiologist. We're trying to plan out how much more time there's needed. That way he can adjust and modulate the anesthesia. And of course, when you're doing anesthesia, you're giving medicine to a patient, and you have to constantly give the medicine. It's not like you just give it one slug and you're done. It's a constant, what we call infusion of medicine. And if you want to wake your patient up, you got to eventually turn off that infusion. So that's what we're talking about. When do we turn that off? When are we going to be done? Who is that? Is that? Please don't do that. Man, look at the tear right there in the PLL. Big tear in the PLL right there. You can see a little bit of herniation down there. That's the posterior ligament right there, posterior longitudinal ligament. You can see how fibrous it is, right? And that's what we went through the ALL when we came in through the front. Anyway, because it's damaged, there could be little pieces of herniation. I have to look. By the way, the PLL will also heal. All right, let me flip sides because this side's looking pretty darn good. We're not at 100% yet, but we're pretty close. Let me flip sides and start looking towards her right. Remember, she had a tear and herniation on both sides. You can see the little bit of bone spur right there. It's not really doing anything. It's not pushing on a nerve. I would leave it alone. Bone spurs, you don't want to be cutting out a bunch of bone spur. If you start just chopping bone spurs out, you're going to get bleeding. And more importantly, you're not helping the patient. So people ask me all the time about bone spurs. Oh, you're going to get the bone spurs out. Yeah, I'm going to get the ones out that you need out. But the ones you don't need out, we're leaving them there. Because taking them out is not going to help you. It's only going to make your surgery worse. It's going to create more bleeding and more problems. And the more you mess with bone spurs, the higher, I think, chance that you could auto-fuse the disc. So if you mess with the bone spurs too much, remember, you're decorticating, right? When you're messing with a bone spur, you're taking the cortical bone off, exposing the diploic bone underneath. Well, that's how you fuse, folks. When we're doing an ACDF fusion or a PCDF fusion, what's fusing is the bones. So we're actually, decorticating, taking the cortex off the bone and exposing the diploic bone and hoping that the bones fuse together at the diploic bone. The diploic bone will grow a bony bridge, a cortical bridge from one diploic area to the other. All right, now we're looking into her right foramen. She's got a little bit of herniation here as well. Look at the tear right there. Yep, there's some herniation right there. We're going to get rid of that, and then we'll be done. So, a lot of scar tissue here too. All the white stuff. That's not annulus anymore. That's scar tissue. So, why does there scar tissue form? Have we shown the video yet on how the DLDR works?
Not yet, not yet,
Huh?
not yet.
Let's play that. All right, welcome back. Yeah, you can see what we're doing here with this endoscope and laser. We're going to the back of your disc and we're taking these pieces of herniation out. There's another one. Trying to get it to just float up and out. We're almost done. How much time you have left on that one? God, this thing is just not coming. All right, Henry, you got some more questions for me?
At this moment, no current questions.
Great. We are just about done. You guys see this is a bloodless surgery. There is no bleeding. We lost not even a full drop of blood. Well, there. Now we got a full drop, so one drop. One drop of blood. Amazing. No scar tissue from the surgery, no bleeding, no hospital, no stay overnight or anything. It's just a Band-Aid, and that's it. That's fine. And then she can actually go home today. I do want to see her back in the morning. She is here with her mom, and we're gonna check on her in the morning, see how she's doing. But so far, surgery's going perfect. We're out the right foramen right here. Couldn't have gone better. Again, she's from, flip it, Pennsylvania. We get a lot of patients from the Northeast because they don't want to have the fusions done. The surgeons up there, all they do is recommend fusions, artificial disc. Look at all those pieces. You see that? Like a little train of herniated pieces. It's so cool. Here's some more. You see the spiky periphery of those. That means they're a recent herniation. Recent herniations are not smooth on their outside. Their periphery, they're spiky. All right, I think that's it. Done.
Sitting on, please. Thank you.
Great job, everybody. Little antibiotics. Now, we do give our patients IV antibiotics. usually a third generation cephalosporin, right? Or is it first? First generation. Yeah, ANSEF for skin flora. All right, we're done.
Kira, I have pieces over
A
here.
little bit, see that? Look at that right there, folks. Virtually no bleeding, just a drop of blood. And I'll show you the incision. Any other questions, Henry?
Yes, we have about 2 questions so far.
So I'll come and answer them face to face, all right?
Copy that?
You've already shown them how the DLDR works and why people get pain in their neck and headaches.
Yes.
Let me show you the incision one more time. For those of you that have a herniated disc in your neck or a degenerated disc in your neck, this is the way to go.
Kira.
So she's intubated. We're going to get the tube out in a few minutes. We're going to wake her up, send her to recovery room. She'll spend about an hour there, maybe an hour and a half recovering, and then she'll go back to her hotel with her mom. She has to wear a collar. We put people in a collar for 6 weeks. That's just our standard 6 weeks. And then we give them restrictions. Pretty much lifting restrictions is all we give. Yeah, that's good. So I'm going to show you guys the incision, but I want to go through the restrictions. The restrictions are lifting. No lifting over 25 pounds the first 6 weeks. Because remember, whatever you're holding in your hands goes straight to your spine, in your neck. Your arms are attached to your neck at the spine. And so anything you lift goes and puts pressure on the discs. And then no lifting over 40 pounds the first year. There's the incision. You all see it?
Yes, we do.
It's literally one steri strip and a Band-Aid. That's it. Good job, everybody. We're going to wake her up now and get her over to recovery and then out of here. Type your questions up. I'm happy to answer them for you. But one down. Our next patient is a thoracic herniated disc, and he's traveling here from California to get his thoracic disc herniation treated. We're going to do a bilateral. I think it's T6-7. So it's going to be a good case. And then the last surgery for today will be lumbar. So we're going to do cervical, thoracic, lumbar all in one day. Right here at Deuk Spine. We're going to broadcast all the surgeries for you guys to watch. So you get the whole spine today. All right. Thanks, Henry. I'm Dr. Ari Deuk with the Deuk Spine Institute. We have a patient who just had surgery yesterday. And if you were tuned in online watching our live surgery broadcast, you saw her get 2 discs fixed in her neck. She's had a prior fusion done with an ACDF and a metal plate, so we fixed the disc above the fusion and below the fusion. She had adjacent segment disease. And how long were you suffering with neck pain and right arm symptoms before you came to Deuk Spine to get it fixed yesterday?
Over 20 years.
Over 20 years.
Over 20 years.
And you had the Deuk laser disc repair done. You can see we had to make 2 incisions on the front of your neck. How do you feel after the surgery you had yesterday?
Awesome. Never felt like I've not felt like this, and I couldn't tell you how many years. I've not been able to actually have a normal life due to the pain. Hurting so bad, having to lie down during pretty much after lunchtime.
Do you still have that pain right now?
No, sir.
It's gone.
Gone, yes.
Yeah, your neck is still a little stiff, and you
Yes.
got to get used to that. But you did have the fusion, fusions always cause neck stiffness, and we can't fix that. But the pain we can fix. So the pain you had before is gone.
Yes, sir.
You happy?
Very, very happy. That's an understatement.
Now you have a funny accent because you come from Bluff City, Tennessee. Isn't that right?
Yes.
All right. And why did you travel to Florida for your surgery?
Done a lot of research, and then I found you. Thank God. Greatest blessing that I've ever had. Best doctor I've ever been to in my life.
Thank you.
I can't really put into words how I feel. it's beyond. It's the greatest blessing ever. It truly is.
Well, I'm glad you're doing well. I know your husband is here. He's been very supportive. He was here throughout the surgery yesterday, and you can actually see in the video footage that we made 2 tiny little 4mm cuts in the front of your neck, went down through the neck, not damaging anything inside, and getting to the herniations where the tears were. And actually, you could see the tears on the discogram that I did, and they were big, and we were able to get in there and clean out all the herniations with the laser, and we didn't have to do fusion anymore. We didn't make your neck any worse than it came here with. And the nice thing about the Deuk laser disc repair is it's a stabilizing procedure, getting rid of pain and neurological compromise. I checked you today. You came to us with weak arms, and now you have normal strength in your arms just 12 hours, 24 hours after your surgery.
Yes. Not had that in so many years. So many years.
All right, well, is there anything else you want to say to your fans out there?
Anybody suffering with chronic pain, you have no idea. It is well worth coming to see. Like I said, he's the best doctor I've ever been to in my life. He actually cares. First doctor I've ever had in my life to hug me and ask me how I'm doing.
And compliment you on your nails.
Exactly. He loves my nails.
I
He
do
loves
love
my
your
nails. Highly recommend him, like I said. Very well worth everything. He truly does care. And the team here is awesome. The nursing staff, everybody was tremendously, I can't express enough how everybody was so good to me and just went out of their way to make sure that I had everything I need. I was comfortable. You know, it was just a very wonderful experience. It truly was.
And I appreciate you sharing. You also had the Deuk plasma rhizotomy, I just remembered, because she had facet joint pain as well as the disc problem. And she was having pain turning her head to the right, weren't you?
Oh yeah, I was having extreme pain. I was turning to when I couldn't hardly turn to my right. It was going down into my right arm extremely bad.
And that's gone.
Yes.
Amen. And it's gone permanently. So I'm very happy for you. When are you heading back home?
Saturday morning.
All right. Well, enjoy Florida for a few more days. You take care of yourself. You've got my phone number if you need anything.
Yes.
All right.
I thank
take
you
care.
so very much.
You are more than welcome. It's my pleasure to take care of you.
Even with my funny accent.
All right, let's get you out of here, okay? Go enjoy the beach or something. All right, wow, what a testimonial. And we have all these recorded testimonials we play for you. Patients who have come here, they've spent hard-earned money to get the surgery done because they don't know if their insurance will cover it or not, and we have very great results, and the patients are very appreciative. And we now have a few patients watching from past who are sharing their experience, and as Henry pointed out, they're saying that they're doing great, so we're very happy for you. Okay, surgery's done. This is a young lady. She had a soft disc herniation. Yes, Dr. Patel, do you need me?
Nothing. I was just checking.
All right. Making sure I'm working?
Yes.
Dr. Patel is checking on me to make sure that I'm working. Yeah. And I'm working. So anyway, this patient had, if you look at the spectrum of a disc herniation, you've got a fresh annular tear, fresh herniation, fresh is in, 6 months or earlier. And then you've got herniations that are on the other end of the spectrum, that are like years out, 10 years, 20 years. And these are the people that will come in and say, I've had neck pain for 20 years, 30 years. You get into that disc, you look around and it's just degenerated, collapsed, but we're still able to fix the pain that's coming from those discs because the source is the same. It is the tear in the back of the disc, and it's the herniation in the tear causing inflammation, which we showed you earlier. It's all about inflammation. Folks, pain in your body comes from inflammation. Why are we ignoring that? We shouldn't be. As a matter of fact, I knew it was inflammation for years, but the neurosurgeons that taught me, they ignore the inflammation. We only deal with inflammation when it's related to infections, viruses, bacterias, or transverse myelitis of the spinal cord. But why aren't we dealing with inflammation that's causing daily pain for people? We should be. So I've tried bringing this whole issue to the neurosurgeons, to the neurosurgical community for the last 15 years, 20 years, telling them we can fix people's pain if we address their inflammation going on in their spine. Well, now at Deuk Spine, you know what we said? This is what we said. Come on, guys. Come on, everybody. Come on. And they just ignored us. So you know what we said? We didn't say, oh, well, we'll just stay with the sheep. We'll just stay with the pack. You know, we said no. We're here for one reason: the patients, and we're here to make patients better, improve their quality of life, take away their pain, and we can do it. So we just kept going, and next thing you know, we look around, and the rest of the pack is still eating rocks, and we're over by ourselves having grass and checking out the ocean view. So unfortunately, it's true, most surgeons, most spine surgeons, most pain management doctors, most people treating back and neck pain, they don't know how to fix your pain permanently, but we do. And we've broken it down. There are 30 causes of neck pain. There are 30 causes of back pain. And we are going to release our new website probably by the end of the month, this month. And it won't be 100% complete, but it'll be pretty close. And it's going to be an incredible educational experience. We have all new animations, yep, which we have been working on now for almost about a year.
A little over,
yeah.
Almost about, yeah.
We're going to have about, by the time we're done, 30 animations that we created ourselves, built with a team out of Sweden. And it's going to show you in amazing detail where the inflammation is coming from and how to fix it, how to fix the pain, not the inflammation. We can fix the inflammation in the disc. We can't fix the inflammation in the facets, but we can get rid of the pain in the facets. We can get rid of the pain in the SI joint. We can get rid of the pain and inflammation in the piriformis muscle. So we've got about 99% of back and neck pain covered with our procedures. All right, we'll take our first question.
First question comes from, I love this name, Pure Honest, Very Caring on Facebook.
Pure Honest, Very Caring, welcome to our live stream.
They ask, after 2 lumbar fusions, 2 big herniation removals, and S1 discectomy, after surgery and withdrawing from all the pain medications and injections, how long does it take to rebuild your strength if before and after is majorly below 0?
Yeah, I'm going to assume what you're talking about is you had a pinched nerve and that you lost strength in your foot or leg. I believe that's the strength you're talking about. But it could be that you're talking about the strength of your back muscle. So there's 2 types of tissues that are affected with spine disease that's degenerative, okay? Degenerative spine problems are those that affect the discs, the facet joints, the SI joints, and basically they're an injury to the joint years ago, usually in most cases, and over time that joint has inflammation, which just keeps going every day and destroys the joint, right? It makes it structurally not look like a normal joint, whether it's the disc, the facet, the SI joint. So we're dealing with the effects of chronic inflammation. And if you watch my productions, my videos here, you'll know that I make inflammation likened to war, okay? And your inflammatory system, which you can't see, by the way, it's invisible, it's microscopic, microscopic, so invisible to the naked eye, but you could see it if you had a microscope and you were looking in the right spot. Your inflammatory system is like an army, okay? Don't take offense if you're part of the Marines, Air Force, or Navy, but let's just say an army. And it's got soldiers, and they've got guns, they've got grenades, they've got RPGs, they've got tanks, they've got basically munitions, things that allow them to blow things up, structures up, destroy structures, right? And that inflammatory system is at work in your disc, your facet joint, your SI joint for years, fighting, kind of like in Ukraine right now with Russia. And if you look at the cities like Kiev, you'll see that buildings are blown up, they're ripped apart, right? Same thing in Israel and Palestine, in the Gaza Strip right now. Buildings are in rubble, there's rubble, and that's because of the fighting that's happening. So there's a war going on, right? But what's crazy is that your body's inflammatory system is like the Israeli army, very powerful, basically unbeatable, and it's attacking itself, unfortunately, not like the Israelis, but it's attacking itself. And it's attacking your normal structures, thinking that they're foreign invaders when there's really no foreign invader. Okay? And so they're just bombing the hell out of your joints. And the joints are becoming degenerated. That's what you see on the MRI reports, X-rays, CTs. So how do you deal with this? Well, if you want to get rid of your back pain, 87 or 85%, to make it easy, is from a war going on with inflammation in the disc, annular tear, herniation, which triggers your inflammatory system, your army, to attack. Right then, right there where the tear is, causing horrible back pain. All right? So that is the biggest problem. And what I do is we go in with the laser and we clean that tear out. Now, when we have these degenerated problems, sometimes the inflammatory tissue, the scar tissue or inflammatory tissue, and the herniation or the bone growth or bone spurs can get so big that they pinch nerves. And the nerve roots that are being pinched go down to your muscles and your skin, and sometimes to your sexual organs. Point is, let's not pay attention to that, let's just focus on muscles for a second. Well, when the nerve is getting pinched for so long, it's getting crushed and crushed with every movement by those inflammation, by the herniation, by the bone spurs, scar tissue. The little nerve fibers that are inside that are microscopic, they get damaged. And you start getting weakness downstream because you're not getting enough nerve signals going down to the muscles. So you get weakness in your legs or your arms or your neck muscles, okay? And when you unpinch those nerves, it's going to take up to a year or two for those nerves to fully function again. So you got to wait a year or two. All right, then there's a second type of weakness, which is really muscle atrophy. This is basically people in pain that don't want to move. They don't want to do anything. They don't want to be active. So they just sit there, and when they have to look, they go like this. Rather than turning their head and using their muscle, they turn their body. And so we see this all the time in the neck, the back, and people's muscles, they get atrophied and weak. Now that could take a year or two to build up, or even longer. So you've got muscle atrophy, you've got nerve atrophy, which then causes muscle atrophy. Those are your 2 points of weakness, and that weakness could take a year or two to go away. Now, you may have weakness because your nerves are still being pinched, or you may have pain, which makes you not want to move. If that's the case, you need to do one of our free MRI reviews. Just go to mri.deukspine.com on our website, and I could tell you why, if you still have a pinched nerve, why it's pinched, and how to fix it. All right, next question.
Next question. These next two come from Charles on YouTube.
Hello, Charles.
His first question asking, if you encounter bone spurs that are pinching on nerves, can you address them during this procedure?
Yes, Charles. That laser can melt steel. If you look carefully at the inside of the tube, you'll see where the laser hit the steel and melted it. Bone spurs are a lot easier to get rid of than steel. So anything that can melt steel or remove steel can remove bone spurs. As a matter of fact, we use drill bits made out of steel to remove bone spurs. So rather than using a drill, which is very imprecise and you can't really see what you're doing, we use a laser, far more precise. But the laser can remove whatever bone spur I want it to remove. Point is, I don't want it to remove most of the bone spurs because that's going to promote fusion.
And then his next question asking, does the age of herniation affect the outcome?
The age of herniation does not affect the outcome. You can wait and get it fixed later, or you can get it done now. What the age of herniation affects is your quality of life. If you don't get it fixed today and you put it off for a couple of years, your life sucks because you're going to keep getting back pain, or you're going to be afraid to get back pain, so you're not going to do the things you want to do.
And that is it for questions.
All right, thanks for joining us. Next patient is we're going to attack it on both sides, thoracic disc herniation. He's got a bilateral thoracic herniation. We're going to come transforaminal on both sides, endoscopic, and we're going to clean out that tear. He's got a horrible pain in his thoracic spine, and every time he does things, it sets it off. He's from California. He's a bit older. I think he's in his 70s. He's got a lot of bad discs in his thoracic, but this one is the big one, and this is where he localizes his pain to. So we're hoping we fix this, we get rid of 80-90% of the pain. Join us in about 20 minutes. Thanks.